Hi, everyone. Just going to give it another minute for Dr. Ekbo to arrive. Thank you all for joining us. Hi, Dr. Ekbo. Can you hear me?
Hi, Kristen. How are you? Yes, I can.
Okay, now I can hear you.
Okay, it's a bit of a delay, but yeah.
How are you?
I'm doing well. How about you? How are you?
I'm doing well. I'm just going to make sure that the view is on. Okay, I'm going to put it on speaker view and we should be all set. Thank you for joining me today. For those of you who don't know me, I'm Kristen Hodgson. I'm the founder of the Fertility Tribe, and I'm very excited to introduce you to Dr. Geraldine Ekbo of Laurel Fertility Care in the Bay Area. And we're doing an encore event of our Q&A all about the COVID vaccine while trying to conceive or pregnant. So thank you again for joining. Oh, Nicole just asked me to change the view. Done. Oh, I see gallery view. Sorry, hold on 1 second. I'm not sure I know how to do that. I'm just gonna put it on speaker view and then, okay. Okay, so jumping right in, I noticed yesterday that the ASRM came out with just guidelines affirming their stance that, they recommend the COVID vaccine for all women who are contemplating pregnancy or who are pregnant in order to minimize risks to themselves and their pregnancy. So I know we talked a little bit about it last time, but so when your patients come to you saying, should I get the vaccine? What is your typical response?
Yeah, we spoke a little bit about that, and I think it's timely. It's a conversation that we're going to continue to have, and SRM is constantly trying to update their guidelines. Every a couple of weeks as we know more about the vaccine. The stance generally in the United States with the CDC, with the ASRM, the American Society of Reproductive Medicine, is that, and ACOG, the American College of Obstetrics and Gynecologists, is that we think that this is a vaccine that is okay, it's safe to take in pregnancy because we believe that even in the absence of studies in pregnant women, the risk of a severe COVID infection compared to the risk of issues with the vaccine, the having a COVID infection is a more significant risk in a pregnant woman than any potential side effects from the vaccine. I'm encouraging patients to get the vaccine when they're able to. Right now, we know that the vaccine, we're trying to be better about the number of people that are getting it. We didn't have the best rollout nationally. However, the focus of priority are healthcare workers, so people who are high risk, and then women, people over the age of 75, and now in some states over the age of 65. And as we make it more available to everybody, of course, more questions are going to come up about when to take it or if to take it and if not to take it. But the stance right now is pregnant women who happen to be healthcare workers or who are at risk for getting this virus should make it a priority to get the vaccine.
Okay, great. So yeah, you briefly mentioned timing. I know a lot of our community wanted to know if they're trying to conceive, if they're in the thick of fertility treatment, is there any specific timing that you don't recommend prior to egg retrieval, prior to embryo transfer,
Yeah,
or does it not matter?
absolutely. Good question. So it's good to separate women who are already pregnant from women who are trying to conceive, right? So you're already pregnant, you decide and you have that conversation with your physician what your risk level is. You're trying to conceive, you're a healthcare worker who is at high risk. The thing about pregnancy, I think, is most of us, in most of the women or couples in the chat today know that we can't really time it the way we think we want, unless maybe you're doing a frozen embryo transfer or an IVF cycle. So if you're just trying to conceive on your own, as much as we think that we have control on when implantation is going to happen, we really don't. And so we say if you're trying to conceive and you're at high risk, it's probably, if you had to pick a time to get it, it will be before you get pregnant. However, I wouldn't delay trying to get pregnant just to get the vaccine. If you get the first dose and you happen to get pregnant, the stance nationally is that you can still get the second vaccine whenever you are due to take it. Now, the question comes with things that you can time. We know that the Moderna and the Pfizer vaccine, one of the side effects, which is actually not as common as people think, is the risk of fevers. And so having fevers, which is, we're seeing that more after the second dose, less so in the United States than in other countries. But if that's the one thing that you can control, is if you have a frozen embryo transfer planned on a specific date, and there's a risk of a fever, then you know, you know, within 24 to 48 hours of that vaccine may not be the best time to do the transfer, which is what we think about fevers and implantations in general. So if you can control it, the date you get your second vaccine is not necessarily stamped in stone. I know with the Moderna vaccine, I believe it's one of Pfizer is 3 weeks and Moderna is 4 weeks after for your second dose. But there is some wiggle room by a couple of days. So I think talking to your fertility doctor and trying to take advantage of that. It's okay to delay. We're not mandating this. We're just saying that you don't have to.
Got it. Got it. So, I think that there were some, rumors going around, I guess that could be the right word, about how the vaccine could affect fertility, specifically male fertility. What, if a patient came to you with that question, what would be your response?
So actually, the rumors I've heard, I guess it's for male and female, and you can fill me in on what you've heard about the male one more. I think the concern is sperm production in men, which again is the same fever argument. The vaccine can increase fever, increase heat and that can then affect sperm production. Not uh, not true. That I think that I would classify that as a myth because it doesn't make sense in terms of, number one, the sperm we see today, was produced, usually 70 days before ejaculation. And so you're not really seeing an immediate effect. Men have conceived after vaccines, men have conceived after having fevers. Could you potentially see a decrease in the concentration amount of sperm? Maybe, but I don't know that you can directly relate that to the vaccine itself. As a reminder, the way the vaccine works, it's an mRNA vaccine, meaning it's very different from vaccines. And I think that's a little bit of the hesitation that we know about. The hesitation to get it is, in the past, we've studied vaccines for decades. We've, introduced a sample or a live or weakened form of whatever the virus is. And then the body learns to immunize yourself, protect yourself from it. With the mRNA vaccine, we're not introducing a virus. We're just giving you the vaccine is giving the body the tools to fight the vaccine. Once the mRNA gets into the body, it's degraded, meaning it's completely destroyed within 10 to 20 days. So it's not hanging around there to cause issues. The moment it's there, it tells the body what to do. The body makes the antibodies needed to protect you, and the vaccine cells itself are gone. That's how we understand that. So having this all this myths of like, oh, this is something that's going to affect future issues doesn't really make sense with what we know from biology. What I've heard, I think, also is the risk for female fertility with, the vaccine potentially attacking the placenta, because there was one report, I think, late last year by somebody who's already anti-vaccines, who put out a statement and concern that the protein that the coronavirus protein that we're trying to train the body to recognize looks sort of like one of the proteins on the placenta. And so by getting the vaccine, you could potentially attack the placenta, leading to infertility, which technically infertility, you're not yet pregnant, so there is no placenta. If anything, maybe miscarriage. However, that's not true. There's a very small segment of the protein that's very similar, but there's a huge, segment of the proteins in the placenta that has nothing to do with the virus. So that came out and that was perpetuated on the internet, and people have, sort of held on to that. As a reminder, when women who were in the study, got pregnant without planning it after, no, there hasn't been an increased number of miscarriages in people who got the vaccine versus those who didn't. And so that tells you there that that theory really doesn't make sense, because then everybody who's been exposed to the vaccine will not conceive or will miscarry, and that's not the fact. So those are the myths I've heard. I'm welcome to address any specific ones you've heard, but based on the biology and how we know the vaccine works, it just doesn't add up.
Yeah, I think one of the common misconceptions is that it's a live virus, and from what we know about the mRNA, it's not a live virus; it's newer technology. So people can feel a little bit more confident in getting it, especially if they're pregnant or breastfeeding or trying to conceive. So I know a lot of the concern from women who are in this category is that there's no studies that have been done on this population with the vaccine. And why is that? And what would you say to those concerns?
There are a lot of studies that haven't been done in pregnant women. There's a lot of things that we do in pregnancy that we haven't studied. We haven't studied in a way that we can make strong recommendations. We tell women all the time not to drink in pregnancy. If you look truly at the basis of the study, it's the safest thing because we can't quantify how much or what not. So to be safe, you just don't do it. So if you go based on just trying to be safest, sometimes when we have data in pregnant women, we feel more secure. There are some countries who are telling your pregnant women not to get it because they don't know. And I think that's valid. However, again, we want to weigh the risk of getting the virus against the risk of getting pregnancy. The risk of getting of any issues to the fetus or to the mother in pregnancy. Why is there no data? It's very hard to sort of select for pregnant women to be part of studies, and it's not necessarily a thing that we're proud of in the medical community. I think in general, it's just harder to get these studies approved, because you're always thinking about the second patient. Is this really worth it? Even people are trying to conceive. It's not just about the mother, it's about the child. It's about long-term effects potentially. And so a lot of vaccine studies don't usually start out with pregnant women. Over time, once we confirm safety data in non-pregnant individuals, we can then start to include pregnant women in future studies. So what we know is based on women who got the vaccine, and then we can observe them to see what happens if they had not planned a pregnancy and they got pregnant. So that's called an observational study. It's already happened. Let's see what the issues are. And so you need time to get that information versus let's intentionally give you the vaccine while you're pregnant and see what happens. That's the true standard, a randomized study, where some people get it, some people don't get it, and then we watch. So to answer your question as to why is there no data yet, it's because pregnant women, unfortunately, are not a priority when trying to select. We're going to go with the healthy people who there's less to lose if there's an issue with the vaccine. It's a new vaccine in the sense that, the technology has been around for a while. We've been working it for at least, or the people who know better than I have been working on it for at least 20 years now, and just didn't have an actual virus to target. And this was just the right opportunity. So some people don't want to get it because they think, well, it came about too fast. It's very suspicious. But the technology, the base has been there, right? It's just a matter of adding all the other things to target this specific a virus. And I mean, it's safe as in it's not going to give you COVID. In terms of, we know that it does not cross the placenta. So things that we worry about with certain things that the mother is exposed to. That's not the case with the mRNA. It cannot cross the placenta to our knowledge. It's degraded quickly in the mother's body. Um, and yeah, based on that information, we can only surmise that it's safe. In rats and animal studies so far, they've been able to conceive and have no issues. But again, we're very different. But from what we know, and we will get safety data, we will get eventually over the next couple of months. And I think as a vaccine becomes more available to women who are not healthcare workers, that's the bigger question. The people who are just, I'm pregnant, what should I do? Should I get it or not? And I'm hoping that the CDC and the ASRM will continue to update those guidelines as Pfizer and Moderna share their data.
Yeah, it's been encouraging seeing the healthcare workers, getting their vaccines and kind of squashing some of those misconceptions about the vaccine. And I think with the infertility community, it's so touchy because, so many of us, when we finally get pregnant or are finally getting to that embryo transfer, it's like you don't want to add in any other outside
Absolutely.
factors too. So I think, so as a physician, if it's more fear-based, do you tend to kind of, let the patient decide, obviously, right?
Absolutely, that's very valid, Kristen. I think we can underestimate sort of the emotional component of needing fertility treatment and trying to conceive and not being able when you thought it would happen easily. And so it's an informed conversation. So it's addressing those fears and figuring out where it's coming from and trying to reassure. We have the same fears for everything about an embryo transfer. Should I lay down for, how many minutes after the transfer? Should I take these supplements? Should I do these things? And then it's a matter of a lot of what we do in medicine. It's an art. It's a matter of it's not always clear cut science. It's what's the pros, what are the cons, and what are the risks, what are the benefits, and just coming up with your own individual assessment. So in patients that I know have the fear and have the anxiety, I try to reassure them this is the least thing you should worry about, but I get it. And if you don't feel comfortable, we wait. We don't get it. And as we get more information, you can make that decision eventually. At the same time, this is what we know about COVID. This is what we know about what happens when you're pregnant. You know, what's the balance? So I absolutely don't think it's our job as physicians or people in the community to tell people you have to do this. It's our job to say it's safe to do it. But I hear you. If there's a concern, I will try to allay those concerns as much as possible. And ultimately, it's your body. You make that decision.
Absolutely. Someone just asked in the chat, if a pregnant woman gets the COVID vaccine, is immunity passed on to the baby?
Yeah. So what we know about the vaccine itself, the mRNA is not passed on, but the antibodies that are created, technically, we think can cross the placenta. And from what we know so far, again, limited data that we'll hopefully get. Same thing with lactating mothers, where we feel that the antibodies are being passed down through the breast milk once the woman develops those antibodies. So that's the theory. We will know more sort of how long is that immunity. Right now, we don't know once you get the vaccine and get your booster, how long you're protected for. And so in the same vein, how long is that immunity passed on to your infant? I think ultimately we'll have studies that are looking at women who get the vaccine and how much of the antibody is in their system versus in your child, in their baby after birth. And so this is the phase of getting all that information. It's quite exciting to sort of see what we all find out, but I understand that given sort of the stress of the pandemic itself, there's a lot of anxiety.
So I did hear that some women's doctors kind of advised against the vaccine. What would the reasoning be for that? I know that in the UK, there were some guidelines early on that did not recommend it, I guess, due to the lack of studies.
Yeah, so it's different, interesting. So the in the UK, there's the government. If you go to their website, the official stance is we don't have information, so we don't think you should get if you're pregnant. The caveat is if you're pregnant, a healthcare worker and high risk, you may want to consider it. So people need to remember that. So if you don't consider, so take the pregnancy out of the equation. If you would have usually gotten it because of what you do for a living or your exposure, then you get it. Then you can put the pregnancy back in. So we're not treating pregnant women any differently who are healthcare workers at a high risk right now. There's a separate physician group that looks at the Royal College of Obstetrics and Gynecologists in the UK, who have said that we think that even though the stance is that there's no safety data, we're still talking to our patients about it. And ultimately, these are guidelines. These are not sort of laws. And if that's what the stance in the UK is, and that's what you feel comfortable doing, that's okay. Well, now, in terms of actively advising people not to get it, again, we don't know the safety, but I think you should really have that conversation as to sort of what are your risk factors in specifically to you versus sort of a blanket statement not to get it. Men who have a high risk of reaction to vaccines, so what we call an anaphylaxis, so a reaction where you're unable to breathe, difficult, like full body reaction to certain vaccines in the past, should not get the vaccine. That's the one group where we're saying we don't know that it's safe for you to do so because of that reaction that can lead to shock and potentially death. And that's the one group that I know that we should be actively recommending not to take. But just being pregnant, I don't know that saying don't get it just because we don't have data is the safest thing. There's a lot of things we do without data because we understand the biology and we say, these are the chances, this is the likelihood, let's get it.
Right. Yeah. You kind of have to weigh your own risk factors and how comfortable you feel with if I were to get the virus, if I was pregnant, it's definitely a personal decision.
And respecting that decision, I think it's your personal decision. I think that you can believe that and not take it. And I don't think you should be judged or treated differently. A lot of people would love to have access to the vaccine and don't. If you have access and you're declining, that's okay. Just be cautious. Just do all the things that we know. Wash your hands, wear a mask, protect yourself. Don't, be the social distancing. Those things really work as much as we try to politicize it. And I think that it's important that we remember that there is science and we can follow the science and believe what you believe. But I don't think you should, force your beliefs on others.
So what about if you've tested positive for COVID in the past? Can that affect your future fertility, either in male or females, and then pregnancy as well? Are there any implications down the road?
Not so far that the data suggests people are conceiving and getting pregnant and having good outcomes with their frozen embryo transfers with their IUIs after a COVID infection. Technically, we don't know how long the antibodies protect you for, but just the fact that you got COVID, the argument against that is something as simple as any other virus. If you get the flu, does that mean you can't conceive in the future? What's the long-term effect? Your body is going to mount the response, an anti-inflammatory response. You're going to not feel great for whatever period for some people, but eventually you should make antibodies to protect yourself, and then that phase is over. A flu is not usually this is your future fertility. So that's the way I look at it when I counsel patients. This is what we know about this virus in this moment, and that's all subject to change.
Right. Someone actually asked in the chat, what's the general rule of thumb for vaccines in general when trying to conceive or pregnant, like the flu vaccine and all
You want to get your flu vaccine at flu season? Yep. Yes, you do. When trying to get pregnant, it's okay to get it when you're pregnant. There are different types of flu vaccines. You want to get the flu vaccine that's usually not an active live virus when you're pregnant. There's some flu vaccines. I think the nasal flu vaccine, which is not as common, has some activity in it, and that's not recommended for people who are actually pregnant. But the general rule of thumb is typically the flu vaccine is usually available September, October, flu season. If you're trying to conceive, we strongly recommend that you get it. And the flu vaccine is another example of something where it's not always going to be the same The one thing we haven't talked about is the different variants in the virus that has come up. The flu vaccine each year is different, right? So they modify it and then they change it. It's a different booster or whatever to help with your immunity. As we're learning more about COVID, we're seeing that there are some new variants that have come up in different countries and making their way to the United States. And so what we want to do is, and what the companies are doing, are keeping track of when you get the COVID. It's not I get the COVID, you get better, you're done. But somebody's actually taking your sample and analyzing it to find out, is this a COVID we know, is this a new COVID, and making recommendations. Um, and we're trying to keep track to see if there's any mutations or changes in the virus that we need to be aware of. And so I know Moderna and Pfizer are working on some boosters to help with once you get the vaccine for the future. So I just thought about that as we think about the flu, because that's essentially how the flu vaccine works. Is there are different strains, and then we try to put a bunch of things together to fight all the possible strains. And we hope to continue to evolve that technology for the COVID vaccine.
I know, just when we thought we were at the tail end, more variants. I actually think it's a really good point to bring up that when you're pregnant, you shouldn't get the flu vaccine with the live virus in it. I didn't know that. And I think if you're early on in your first trimester and you don't kind of speak up to the pharmacist or the doctor that you might be pregnant, I don't think that's something that they necessarily,
They should be asking you, technically.
I guess they should be asking you if you're pregnant,
but you also should be letting everybody know that this is, when in doubt, this is what's going on. Is there going to be an issue? It doesn't hurt to, but definitely being conscious of that. You're right that earlier on, you may not be thinking differently, but that's actually, a good thing to remember to bring up with your docs and with the pharmacist and whoever is giving you the vaccine.
Okay, well, thank you so much. So I guess the takeaway is that, the guidelines are pretty clear that the ASRM is standing behind the vaccine for women who are trying to conceive or pregnant, but it's ultimately an individual decision that you need to make with your doctor, right?
That is a general guideline. I was just looking to see. It looks like there's some other. I don't know how much time we have. There's one last question that just came in from the chat.
Yep.
Do you see that one?
Oh, are there any non-mRNA vaccines being made with live coronavirus?
Yes, there are actually some companies that are working on the old way we used to do the vaccines. Nowhere near. It's a longer process. Nowhere near. I think there are about 14 different possible vaccine candidates the last I looked, but these two have become available faster because of the mRNA technology. And so, yes, there are non-mRNA potential live vaccines in the works in studies. No early data yet about safety, and those studies take a while, and that's what we've always known about vaccine production. And I don't know how they're going to compete with the others, but I think we'll learn more when we can compare as we get that information.
Thank you. And someone else is asking, sorry, I just scrolled. Could you speak to some of the increased risks to a pregnant woman and fetus if she contracts COVID during pregnancy?
Yes. The big thing is the need for ventilation, the need for intubation, which means you're not breathing on your own and needing support and potentially death, as morbid as it sounds. The asymptomatic slight vaccine sometimes is, asymptomatic, not as severe COVID. They're the usual fevers, body aches, potential increased risk of preterm labor, potential increased risk of issues with the placenta and potentially affecting growth. But the big thing with COVID is the respiratory. So when you're pregnant, you already have sort of decreased lung volumes. Your lungs don't expand as well as they should. There's something taking up space, something precious taking up space. And so you can't breathe the way you usually are. And then put on top of that, there's a virus. And that affects your inability to sometimes take in air, right? So we need to support you. And then some of the consequences of that is sort of decreased oxygenation if you don't get help on time to the fetus, which can then be, have some of the devastating effects. But it's the severe COVID and the need for air support, airway support is the big one with COVID in pregnancy.
Okay, so no risks of preterm labor. Are there risks of preterm labor if a woman has to be intubated while pregnant?
Oh yeah. So risk of potentially having to deliver early. So if we can support you and we want to sort of minimize sort of the impact of sort of think about it, of there's already decreased lung volumes, you're already struggling. So sometimes we have to deliver, we have to do a C-section or get the baby out so that we can focus on your health. So that is a risk, but it's a consequence of potentially having airway issues. So it's not like the COVID itself is going to give you preterm labor. It's the COVID and some of the symptoms that the mother suffers from that eventually leads to potential need to deliver early. If you have a raging severe infection, that by itself can directly lead to sort of contractions, dehydration, and sometimes we can stop that. But if we, the mother is the patient first, and so we will do what we need to do to stabilize you. And if that means delivering early, that is preterm delivery. That is a risk.
Okay, that makes sense. So this is actually a really great question because we do have a lot of followers that travel for fertility treatments. So if you have to travel for, say, a frozen embryo transfer, is it safe to do so if you haven't had the vaccine?
Well, I think it's back to the social distancing and the need for the transfer and where you're going and sort of what your protective measures are. I'm assuming you're thinking maybe outside the country or people who are using surrogates. So I'm just trying to understand that question a bit better. But if you are traveling and there are things that have nothing to do with you getting pregnant, it's just the mere fact that you're in the airport and you're on the plane and, if you're taking the precautions, and I think, airlines are trying to limit the number of people on a plane at any given time, that's your risk that you're taking. That's another reason to get the vaccine. I don't think the vaccine makes you should still take precautions after getting a vaccine, but you would feel even better if you can plan that around your your frozen embryo transfer. And so what I would say is, take the same precautions you would if you're traveling to visit a family member and ask yourself, is this a good time? Do I need to delay just based on what I know about the spread of COVID? So look at where you're going to. How common is it? How many people are being hospitalized? What's your control rate? What are people doing? Who are you going to be around? What's your clinic doing to keep you safe? And then I would make that decision based on that.
And even like the hospitalization rate and all that stuff is really important because you don't want to go to a location where, their ICUs are
Full,
jam-packed and all things we didn't know we had to think about until now. But
and not every country has the vaccine available. So I think something that came up, somebody who is a US citizen who is in a different country was wondering if the vaccines can be shipped to them over there because they don't have access here. Unfortunately, no, they would have to come back home to get the vaccine. That's a different question, but every country is very different. Know where you're going and know what your rules are, know what your exposure risk is going to be. I think the WHO is tracking rates in different countries, and each different country has their specific. For us, the CDC, you can see sort of even in the United States, it's very different in Los Angeles, which is in California where I am, versus here in San Francisco. So it's all very regional, and you want to take that into account.
Yeah. So we had kind of talked about this earlier, but someone is wondering if there are any risks or concerns about men getting the vaccine while trying to conceive.
No.
Okay. Well, I think unless anyone has any other questions to add, I think that was everything on my list.
Okay. Well, thank you for organizing this. Hopefully we can get the word out there and more of your followers learn more about this and about the vaccine, the safety, and, again, talk to your doctor one-on-one, get to know your individual situation. and make that decision, make the decision that's right for you. Better to be safe than sorry.
Absolutely. And we're recording this and we will post it on our YouTube channel afterwards. So thank you, Dr. Ekbo. I appreciate your time.
No problem. Have a good day.
You too. Bye.